Hi, I'm Dr. Jessie. I'm a sports chiropractor and yoga teacher, and today I'll be walking you through an assessment as well as a treatment for tennis elbow, a condition that creates pain at the elbow joint but also into the farm. And my patient today is not a tennis player, but he's a fisherman, and that repetitive use from cranking this arm and bringing the big fish in has created pain in this area. So let's get started. All right, so we have Brennan here, and we've been working on his elbow pain, your tennis elbow. How's that been feeling?
It's been getting better. Definitely still have, irritation right here and down here. I feel like I'm pretty tight, and that's kind of why the irritation, but it's kind of like deep.
Is it still been kind of sharp, like
Yeah.
right on the bone?
I would say like right in this area.
So we're still gonna work like your forearm, like how I've been kind of getting in there. But also with Brennan, one thing is that we've been working above the elbow joint, because a lot of times you'll just like focus just on the extensor compartment of the area or of the injury. But we've been kind of working up in the brachialis muscle because he has a lot of tension here. So everything, if it's shortened here and it's shortened here, then the joint and you're gonna feel pain right there. And then also, I'm gonna have you stand up. The other thing, and then just kind of relax your shoulders. So you'll notice that his right shoulder is dropped a little bit here. And we've been working on getting that shoulder. When it dropped, it also kind of internally rotates. So it just rotates slightly forward, and he had an old injury there when you fell off your bike. And we think that you separated your AC joint there, but actually that's really good that you've been getting that shoulder. I mean, the posture looks a lot better with that blade. Yeah. So we're gonna work in here. I really find that you've been getting a lot of relief from working that part.
Yeah.
And then down here. So yeah, you wanna get started?
Okay.
Yeah. I'm gonna have you start out in seated. Yeah, so like that spot especially. And you just worked out? Have you been lifting?
Not heavy.
Keep
Probably
this right here.
50%.
And are you getting any pain in the elbow when you...
Not when I'm working out,
Okay.
but it's mostly when I'm sleeping and waking up.
Okay.
What I've seen, if I'm on my phone too much,
Yeah, and you're bending.
you like this, that's when it gets most
And then
sore.
you're, with the sleep, you like were waking up with
Yeah.
it like flex like that.
I
Yeah.
was wearing a brace. I haven't been wearing a brace lately, though.
Yeah, you gotta get off your phone. But your posture, all in all, like I didn't really even see that when I was doing the assessment. I didn't see that same kind of internal rotation. So I feel like you've been getting this shoulder blade back a lot more.
Been working on it. I think definitely been like working on my core. Definitely helps push everything back to normal. Yeah, I could feel that in my elbow right there.
Yeah, so that's a little bit of tricep and that brachialis muscle, which is important. Have you been fishing?
Nope.
No?
I've been taking some time off.
And you didn't do that tournament?
That's next weekend, but I'm actually...
Are you going to do it?
No, I got hired to take a big boat from Cabo to Long Beach.
Ooh, that's fun.
Yeah, so I'm going to be doing that, which will be a lot of fishing.
And when is that?
Tuesday.
Oh, okay.
8 days in the water.
All right. And like reeling fishing or spearing them?
Both.
All
So I'll
right,
be wearing my brace.
Okay. And then I'll be seeing you after.
Yes. I'll be coming for every day for a week after.
But all in all, you've been feeling a little bit better.
I've just been honestly working through it, but it's ever since I've been seeing you for those 3-4 weeks, it's just gone extremely better.
what I'm doing here is like getting right at, if this is where his pain is, and a lot of practitioners focus in the extensor compartment in the forearm, but I really like to get in here and loosen up the attachments from above the joint. And like you were saying, you could kind of feel it in your actual bone. Now it's starting to feel a little bit softer to me now. How are you feeling?
Yeah, I could feel like it's working.
Let's have you go onto your back. I mean, that's really good so you think engaging and working on your core is helping your posture and your upper body?
Yeah, and I've been doing a lot of back exercises that kind of like force you to, I don't know, I just feel like when you work your core or your whole body, your body starts aligning better.
I mean, I notice it's been a couple weeks since I've seen you, but I noticed like a big difference in your shoulders. All right, so I'm gonna start to get in here into the extensor compartment of the forearm. And you can see Brennan has pretty strong forearms. When did you first start noticing the pain in your elbow? It wasn't from fishing, was it?
Yeah, it was from fishing.
Oh, you did feel it? Okay. So the whole extensor compartment attaches to this region of the elbow. So it's an important area to release, because when you feel pain, when you have lateral epicondylitis, as it's called, it's a tendon injury. So the muscles start to get overworked. Like with you, that's your crank arm, right? And so the muscles start to adapt to the increased demand. And then naturally, when muscles increase in size, the tendon also increases in size. And then the tendon is attached to the bone. The tendon attaches muscles to bone. And so then the tendon starts to become inflamed, and it gives that like real sharp pain on the actual bone. And a lot of times tendon injuries take longer to heal as compared to just like a muscle strain, because they have less like blood flow. I like to work this whole compartment. How's my pressure?
Good.
Good?
You can be harder,
Okay.
softer, whatever you want.
I also like to move when I'm doing deeper work. I like to move loosen up that fascia. So the actual surface where the fascia attaches the skin to the muscle, and it's really important for blood flow. So even a deeper injury, say in the tendon, then it's going to start to harden and thicken up all the area on the surface too. I think we'll gua sha you today too.
Okay.
Okay, I'm gonna lock that in, and then I just want you to wiggle your fingers, especially your middle one. Kind of fight for that one towards me. Yep. Okay, good, and then relax. That's my little spot right there. Go ahead and flex your fingers. Good. And then relax. Let's get a little bit more into this brachialis too. And a little bit of that tricep too. How's that feel?
Good. I definitely felt when you were on that last part, the elbow.
When I was down in here
Yeah,
or up here?
Down, because it
Felt kind of good.
Yeah. Well, it was like a good pain.
Yeah. Did you feel it more when you were flexing your fingers?
Yeah.
Or, okay, let me get in there again. So that helps me to identify. Go ahead and relax. So when I'm getting in here, so right now his arm is at rest, but I like to really hone in on the exact area of the tendon that's bothering him. So when I have, like right there is where I kind of feel it, but then when I have him extend, go ahead and flex your fingers back. A strong forearm. Okay, we have to do it again. I fell off of it. Okay, just a little, right there is good, yeah. A little more is good. When you engage that muscle and you're kind of locking in or shortening out the tendon, then it can relieve pressure from the bony attachment, which is where you feel the pain.
There's the spot right there.
Okay. My form, a little break. And then with you too, we found a little bit, actually that doesn't feel as bad under that compartment, just a little bit right there.
Yeah, I feel like it's all on top.
Yeah, I don't feel anything in there anymore. A lot of times I'll check the flexor compartment. Is this when you make a fist? So that's the flexor compartment of the forearm, and then extend back. And that's the extensor compartment where I was working. But a lot of times I find restriction in the flexor compartment, even if the injury is on the other side. But I don't feel too much in there on you. I'm gonna have you go onto your stomach. Okay. That's good though. So when Brennan first came in, he had a lot of rotation of this shoulder blade outward. So that's common with shoulder injuries, is that the front, if there are injuries there, it starts to rotate forward, but then it causes the shoulder blade to wrap and round forward. So even injuries in the front of the shoulder, I like to address what's going on in the shoulder blade, but you don't have as much winging. I do feel like a little bit more tension right here along the edge of that shoulder blade. Have you been getting pain back here at all?
A little bit actually.
Okay.
Both shoulders. It just feels like it gets stiff.
Mm-hmm. Kind of where I am, or where, okay. Yeah, a little bit right there too. When I'm assessing the shoulder blade, I like to assess all the different attachments. So a lot of people forget about the attachment on the lateral aspect of the blade, but that's where you have really strong muscles like your lat. So I like to get in here too. Is that sensitive?
Oh yeah.
You want me to go a little lighter?
Do your thing.
Okay. So when I have a muscle that is resistant to my pressure, then I like to use my activator, and I'll go right into where the muscle is, where that adhesion is, and I give a little impulse, and it creates a tiny little reflex in the muscle. So after that response, that reflex response, and the muscle softens, and then I can usually find a bit more ease with my pressure, so I don't feel like I'm finding that same kind of resistance. deltoids are feeling good. A little bit more kind of adhesion in here. How does the right side feel compared to your left?
I feel like the right side is, I'm right-handed, so it's definitely more beat up.
Mm-hmm. What kind of fish are you gonna catch
In
on that?
Mexico,
Yeah.
marlin, mahi-mahi, yellowfin tuna, wahoo.
Do you eat marlin?
I like to smoke it.
Oh, so you do
Yeah.
eat it. Okay.
Oh yeah. Those are the fish you can catch, but again, it's fishing. Who knows?
Yeah, okay, right. Like you could get an octopus,
Well, I could get nothing.
or you could get nothing. Okay, I'm gonna have you, let's have you go back onto your back. I'm gonna do a little bit of gua sha, and then we'll do one more thing with you seated. Yeah, I like the list, like all the different fish potentials.
It's
Halibut,
no. I'm
'Cause-
sure there's out there, but we're not targeting that.
because they're on the bottom.
Yeah, mostly pelagic fish.
So it really depends on the injury of when I do gua sha, if I do it before or after treatment. But because I did some deeper work in this area, now I'm going to focus on bringing blood flow to the area, and the fascia and the skin is so rich in blood flow, and that can help the underlying tissue, in this case the tendon. You see how we already start to get a nice little red response? The blood flow, all the capillaries, blood's going to start to come to the surface, but it's also going to help that underlying tendon. You like the gua sha, don't you?
Mm-hmm.
And some people can use this tool to like really get in there. Like you saw, I was doing deeper work. I like to do my deeper work with my hands, and then I use the gua sha to kind of smooth out the area. So I don't dig in there with my tool. I know some people do, but I prefer to keep it light and just to keep that skin moving, keep all that nice blood flow to the area. And also just gets the congestion out. How's in there feel?
Good.
Feels good.
Yeah, it's definitely like close to the elbows when I feel like
When I get closer.
yeah.
Mm-hmm. More on the top.
Mm-hmm.
Yeah. And also when you're working with fascia, it's important to understand how the skin moves. So right now I'm tractioning that part of the skin and muscle down just to expose this area a little bit more. And then we got some nice little gristle right there.
Mm-hmm.
Does that feel okay?
Yeah.
You can actually feel through the tool. It has like an acoustic quality, so I can feel what the tissue is like underneath. Like that feels smooth.
Mm-hmm. I always get so zenned out here.
You do? That's good. Okay, I'm gonna just do one more little pass right here. And then we'll do your shoulder blade and seated, and then you'll be good to go for today. And you leave on Tuesday.
Mm-hmm.
I'm glad you came in today.
Are we gonna do the machine?
We could.
I just didn't know if that's what, I thought that's what we were doing, actually. But I like this better.
I know. Well,
this is much more.
I feel like you've hadn't seen you in a little while, so I didn't want to jump right back into the shockwave, you know. But we can do that next time. I was thinking too that you felt like were starting to get more benefits from this.
This, yeah.
Yeah.
I think I do.
And with where you're at, like the shockwave was kind of good, you know. Initially, when you had a lot of
internal.
Well, yeah, and just a lot more inflammation.
That's right.
And so it was we wanted to, and it had just happened. So when you have an injury like that, when you're initially out of that acute phase, it's good to bring the blood flow and almost, not that you're re-injuring the area, but you're amplifying the immune response. But at this point, right now, I would say that we don't really need to do that because you're more in a healing phase, so we don't need to re-aggravate it.
Yeah.
You know?
That
Now,
makes
if you
sense.
get back from Cabo after fishing a lot and you're starting to feel it really starting to come back, then we can.
After it, okay.
Yeah. But I think that brace will help. And then ice. You'll have ice on the boat because there's fish.
Oh, yeah.
Right? Okay, let me have you come up into seated. I am really happy with that shoulder blade. You've been working hard on that.
Trying to just do all the stretches and everything you told me.
Yeah, but this is great. So right here, I do feel a little. How's that shoulder been feeling?
It's been good. There's right where your fingers are, it'll flare up once in a while.
Right along the bicep. Yeah, so really, even though this was an old injury, we kind of found that it was affecting the mechanics of your arm, which probably, set you up for the...
Yeah, you're right. I think it was this, then it went down to my elbow.
Yeah, I'm just working right in that capsule and right along the bicep. Because when you have a shoulder injury, a lot of times it causes this to tilt forward, and then the bicep will shorten, and then it's just compressing the area underneath as well. But you put on some muscle in here too, because before there was that little weak spot in your...
Yeah, I've been trying to do
bicep.
a little bit more like those Arnold presses and stuff.
But, I mean, it's good because when you started rehabbing everything, it's
That's sensitive.
Okay. It's a tiny little spot. I like to try to find the exact...
You found it.
Okay, good. How long does it take to get from Cabo to Long Beach on a boat?
Between 8 and 10 days, depending on
Whoa.
weather. Yeah.
Oh my gosh, yeah, I forgot Cabo was way down there.
It's 980 nautical miles.
And are you going with a crew?
One other captain and then a deckhand.
Whoa, so that's kind of a small crew.
It's perfect.
That's fun. Is Sushi going?
No, I wish. No, it's a really nice boat, so...
It's like a yacht?
Yeah, he wanted me to let us take surfboards.
Oh, really?
Yeah, because there's some good surf breaks when we go.
Wait, he is letting you or not?
No, not.
Why?
He's an old school guy.
Okay.
He's like,
He just
get my
wants
boat
you
back.
to get your boat back. This isn't just a little joyride. But you get to enjoy the boat and hopefully catch some fish. And it's a fishing boat? That's cool. So fishing's allowed.
Oh, yeah.
All right, my friend. I think you're all set for today.
Thank you so much.
Yeah, you're welcome.
I already feel like just like more relieved.
Okay, good. I'm so glad you got in here before you left. I didn't
Yeah.
even know you were leaving.
I know, you forgot about me.
No, I didn't. All right, that's good.
I just always got to remember to roll back.
What's that?
Do an outro.
Well, I hope you learned something today about fascia and tendon injuries, and thank you for allowing me to work on you and help
Thank you. Yeah, it's hard to like wrap my brain around like this could be preventing or helping this, and then my shoulder blade could be preventing or helping this, and then just like an easy roll back is like
it can reset the whole
Yeah.
chain.
Yeah.
Yeah, I mean that you've been clearly working on that. It's like way better.
Yeah, I'm trying.